Welcome to the San Antonio Alumni Chapter's Good Health Wins program. Good Health Wins is a collaboration of the National Council of Negro Women, NCNW, and Vaccinate family. The purpose of Good Health Wins is to create a network of national and local partners to assist with vaccine education and awareness. Kappa Alpha Psi Fraternity Incorporated is a corporate sponsor and national partner of Good Health Wins, while the San Antonio Alumni Chapter is the local partner that has supported the effort since the beginning of the pandemic. The San Antonio Alumni Chapter also partnered with ADMT Solutions Home Health to conduct local vaccine pop-ups, COVID testing, and vaccine education. The work and experience led to ADMT Solutions being selected as one of 10 agencies to assist Metro Health with vaccine education via a grant from the CDC. Now, to bring it full circle, the education resources provided by Metro Health were created by Vaccinate Your Family, which is a part of Good Health Wins. So we thank you for your participation, and we hope that after this training, you are better equipped to help with vaccine education. Value proposition. ADMT Solutions delivers compassionate, caring services to help our clients and patients improve their quality of life. Our service delivery will demonstrate that we are the team always doing more than to meet each client's needs. Before watching this presentation, we ask that you please complete the pretest. This module is the past, present, and future of vaccination. By the end of this presentation, you'll be able to summarize the history of vaccination, describe the successes in vaccination over time, discuss current vaccination issues, explain vaccination disparities in underserved populations, prepare for future vaccination challenges. Let's discuss the early history of vaccination. In 1870, animal smallpox vaccine was brought to the U.S. In 1881, Louis Pasteur and U.S. Army physician George Miller Sternberg both independently discovered the Streptococcus pneumoniae bacterium, which was responsible for pneumonia and meningitis. In 1878, Native American tribes were effective in southern Arizona, and measles killed many children from 1878 to 1879. In the 1920s, the Metropolitan Life Insurance Company promoted diphtheria immunization in New York City. In 1894, the first major documented polio outbreak in the United States occurred. In 1905, the U.S. Supreme Court upheld the mandatory smallpox vaccination program to preserve public health. And in 1918, the Spanish flu pandemic had a significant impact on global health and prompted advances in vaccine research. In 2009, we had the swine flu. In 1796, Edward Jenner proposed that protection from smallpox could be achieved by inoculating with the related virus, the cowpox. In 1877, scientist Louis Pasteur developed the germ theory of disease, which posited that microorganisms could invade living hosts and cause disease. Pasteur introduced the concept that vaccination could be applied to diseases beyond smallpox, paving the way for advancements in vaccine development. So question, which disease no longer exists thanks to vaccines? The answer, smallpox. Smallpox is a prime example of vaccination effectiveness, with evidence of the disease dating back to ancient Egypt, where rashes on mummies suggested its presence. Smallpox killed about 3 in 10 people infected and left survivors with permanent scarring and blindness. The successful eradication of smallpox was made possible by the development and widespread distribution of the vaccine. Elimination of smallpox was made possible by several advancements, including surveillance systems, mass vaccination campaigns, and new vaccine needles. The World Health Organization's campaign to eliminate smallpox brought funding, personnel, resources, and donations to countries where smallpox was widespread to support mass vaccination. The world came together and decided it was a priority. They put real money and manpower behind making it happen. Vaccine successes over time. Polio is a disabling and life-threatening disease caused by the polio virus. The virus can infect a person's spinal cord, causing paralysis. The paralysis can be lifelong, and it can be deadly. It most often sickens children younger than 5 years old. Polio once caused widespread panic in the US and internationally. In the 1940s, polio outbreaks in the US left over 35,000 people disabled annually. Thanks to the US polio vaccination program, the country has been free of wild polio in 1979. Today, polio continues to be a threat in regions with limited access and vaccinations prevented measures. Present-day vaccine issues. Vaccines for influenza, HPV, and COVID-19 are not typically required for school entry, but these diseases still cause significant illness and death worldwide. In fact, the combined death toll from these diseases can exceed the total death toll from diseases that require school vaccinations. Community health workers are essential to increasing vaccination rates for these diseases because they are not required by schools and other institutions. These deaths are preventable with the help of community health workers. Vaccine disparities. Some communities are less likely to be vaccinated than others. This is often due to systematic racism and racial inequities, social determinants of health, structural barriers, and data collection. Populations with lower vaccination rates will experience more disease outbreaks. Marginalized communities already experience health inequity, so they lack access to the same resources necessary to manage outbreaks, which furthers existing disparities. Schools with fewer vaccinated kids may have more disease outbreaks, and that leads to parents having to take more time off work to care for their sick kids, and less learning potential due to more sick days. Therefore, not getting vaccinated can have impacts beyond the direct risk of infection and illness. It can also affect one's education, career, and even existing disparities. Misinformation is a big problem right now and has been a significant contributing factor to declining immunization rates. Misinformation is covered in more detail in a later presentation, but it's important to note that misinformation has emerged as a serious issue on social media, the news, the internet, and elsewhere. The virus that causes COVID-19 can change over time. Most of the time, this does not change the virus's properties, but sometimes changes can affect how easily the virus spreads, how infectious it is, how it reacts to vaccine or medication, and the severity of disease it can cause. There are multiple variants of the virus that circulate around the world all the time. Some of these variant viruses, like the Omicron variants, spread more easily and quickly than others, and some cause more serious illness. Vaccination against COVID-19 still protects us from getting seriously ill or dying from COVID-19, including the new variants. The best way to protect yourself and your loved ones against the variants is to get vaccinated with a seasonal updated COVID-19 vaccine every year. There is an alarming drop in vaccinations during COVID. According to recent reports from the CDC, we've seen concerning decline in routine immunizations for children. Low vaccine coverage increases vulnerability to disease outbreaks. The COVID-19 pandemic strained the healthcare system, further complicating vaccination efforts. During COVID-19 surges, hospitals may lack the capacity to manage COVID-19 and other disease outbreaks. Future vaccination challenges that urgently need to be addressed. Measles is a highly contagious and dangerous disease causing symptoms like a rash and potentially leading to brain swelling, hospitalization, and death. The widespread use of the measles vaccines has significantly reduced infection rates, with the U.S. declaring measles eliminated in 2000. Measles outbreaks can occur due to increased travelers contracting measles abroad and bringing it to the U.S., or continued spread among unvaccinated individuals in the U.S. Measles remains a global threat and can reemerge in countries where it has been eliminated, especially if vaccination rates decline. In 2019, the U.S. reported 1,282 measles cases, over 3 times more than the previous year. Globally, 200,000 deaths from measles were recorded in 2019, marking a significant increase from previous years. On March 14th of 2025, the Texas Department of State Health Services reported an outbreak of measles in South Plains and Panhandle regions of Texas. At that time, 259 cases have been identified since late January. 34 of the patients have been hospitalized. These are some more resources that contain credible information about vaccines and vaccine-preventable diseases. You can visit the vaccine education page of AD&T Solutions Home Health for links to additional information. That concludes the presentation of Module 1. Please fill out the post-test for this session so that you may get credit. Thank you for listening.